Let's do this. All right, everyone, it is interview time, and we are here with a new guest. We're super excited. This is Suelyn Hall, MD, or do we call you Dr. Hall, Dr. Sue,
Yes.
Dr. Suelyn? Does it matter?
Whatever you like, but
Okay,
Dr. Hall, Sulen, it's all
okay.
good.
All right, Dr. Hall. We're going with Dr. Hall. Who is a urologist and actually recently wrote a book called How to Get Ahead. See that? Secrets to Male Sexual Pleasure from a Female Urologist. So we're super excited about this. We've had a number of urologists on the show. I think we had one female urologist before, but it was less about like the pleasure aspect, more about health. So
Mhm.
we're gonna get all the funsies here. Maybe we can talk about some oral sex. Who knows?
Mhm.
Before we do that, even though you, dear listeners, heard a little bit about Dr. Hall in the intro, Dr. Hall, can you please tell us and our listeners a little bit more about how you got to where you are in the field of sexuality?
Yes. So as a urologist, I actually didn't know what the field was when I went to medical school, and my preceptor, who was a urologist, encouraged me. It's medicine, part surgical precision, but there were only very few women in the field at that time. And so I went to my dean, who dissuaded me from this male-centric field. And so he said, it's a white male-dominated field, and I was like, oh, really?
Mhm.
And I found a female urologist at that time was only 50 of 10,000, and she encouraged me to follow my passion. And so I went into urology at in New York and did my residency there, and moved from the Big Apple to the Little Apple, where I practiced private practice for 20 years before going into academics. And I realized when three of my friends died from colon cancer that we weren't doing enough in preventative health. And so it was my calling really to go into integrative and functional medicine. And that's why I wrote this book to educate more about preventive health and how to get ahead,
Mhm.
as the title is not just sexually, but also to get ahead of our healthy life and our physiology, our physiologic decline, to try to get ahead of that.
So important. I will say, shameless share. Thank you for being a urologist and shameless share. So my partner, his father, he's like my father-in-law. He
Yes.
was just diagnosed with an aggressive form of prostate cancer, and he's 77. But because he didn't go to the urologist that he was referred to last May, he now has the cancer has spread into his bones and his lymph nodes be, because it was a preventative piece. So thank you for
Yes.
the work you're doing. And it's really tragic and sad, but I want to invite and encourage everybody listening, whether you own a prostate or you're friends with someone with a prostate, or you are, in a partnership with someone that like I am encourage all my friends that are penis owners with a prostate to go get your checkups. Go, if you're referred to a urologist, go and meet the urologist. Read the books, right?
Yes. Get ahead
Get
of the
ahead.
disease
You can get
process.
head, but you're not going to be
Yes.
able to get a lot of head if you have
Ah, there
cancer.
you
Right.
Okay,
go. Good.
so
And that's the
Yeah.
thing. And with
yeah.
prostate cancer, we're so good at treating it. There's no reason to not catch it early. There's so much treatments available, but men sometimes are afraid
Mhm.
because they're afraid of the finger, even though mine's really small. So they usually
Mhm.
like me. But
Yeah.
but they're afraid of the exam or the erectile dysfunction that may develop as a result of treatment. So, but now there's MRIs, there's blood tests, and there's a lot less worry in evaluation. They just need to be educated because we as women go to the gynecologist all the time for pap smears, but men rarely come to a urologist unless they have problems. And usually the symptomatic symptoms are usually not known until it's advanced. So we need to get men to see your brothers, your partners, and your father to be evaluated early.
And
Mhm.
that's what I was going to say, Dr. Hall, is that I thought with this, I'm learning, but with this part, talking about prostate cancer, and that's not what
Yes.
this episode is about. This
No.
just came up before we get into your book. But what I'm hearing is that particular diagnosis, sometimes you can catch it, but it's very slow
Yes.
and quiet. It's not necessarily, you won't have issues until you do. So that's why
Right.
the checkups are important. Is that correct?
That's correct. Yes. And African American men have twice the incidence of deaths compared to Caucasian men. And their incidence is 1 in 5 compared to 1 in 8. So it's much more prevalent in people that are so not educated about it as well. And so we need to have a widespread education about prostate cancer and colon cancer because that's a big thing.
Oh, yeah. Thank you, Dr. Hall. And thank you for being this author of this recent book that came out, which is How to Get Ahead: Secrets to Male Sexual Pleasure from a Female Urologist. So it's part science, it's part sexy. So this isn't all
Yes.
just science, science, science. So that's why we wanted to talk to you about how you make this urology actually, and people talking about their prostates or their colons, but how do you make that sexy?
So I define staying ahead as ahead of your physiology, but sexual performance is sometimes the earliest marker of sexual health dysfunction or of overall health. And health is wealth, as we now define it, right? Success is being healthy. And when we started long time ago, the Romans, thought of the penis as a revered part of the body. And then the in Pompeii they have structures and sculptures and art all about it. And then in America we were really more suppressed with our imagination about what the body parts are, right? And what they're important for. Well, The Godfather in 1969 actually started to open us up. No coincidence in 1969.
Hey, opening up. Ooh.
Opening up. But in 72, the mob brought pop culture about the penis into the mainstream, and we went from Godfather to Deep Throat. So, but the mob funded those movies and gave us visuals that made us go from the ancient Rome time to now the American society to not accept it, to not think of it as a taboo, because our societal taboos have really made us not revere the penis as it should be, or appreciate our body parts. And so, it's not just sex, it's also hormones, it's performance, it's longevity, but we want to live I guess, a optimal life by living longer, but not just living longer, but having our highest performance years as we age.
Mhm.
So it's sexy in the sense that um, sexual health actually reduces mental and physical well-being. It actually improves that. So if you're able to find and reduce your stress, which is cortisol, the stress hormone, we can mitigate the harmful effects of heart disease because the penis has the smallest vessels in the body. And so when they get clogged and guys have sexual dysfunction, it may be indication that their heart is going to get clogged, right? Because the penis vessels are smaller than the vessels in the heart. So the important part, the science part, is learning that sexual health equals our physical health or our mental health. And then learning also that sexual desires are important in reducing our stressors in life.
How and desires, when you say desires reducing stressors, is why do you think that reduces stressors to really like
So
tap in and live that out?
yeah, the main thing about that is dopamine, which is secreted when we are excited, right? Or when we are stimulated. It's a positive feedback loop. And the dopamine in our brain makes us having feelings of accomplishment, feelings of happiness. Then that's the mental component. The emotional component is like oxytocin, the love hormone. You develop a bond and trust when someone is sexually involved with you. And this opens up the physical part, which is, feeling good self-esteem, having good body positivity. And all of these things reduce cortisol, the stress hormone. When you're happy and you're excited and you're stimulated, sexual pleasure actually reduces stress. And when you reduce stress, cortisol is secreted. Cortisol can affect heart disease. It can cause autoimmune disorders. It can cause thyroid dysfunctions. So many different things are stimulated by stressors. And by reducing stress, we can protect the heart, our brain, and our bones.
Mm. So there's good stuff in being a sexual being and having desires and
Yes.
fantasies and exploring all these parts of yourselves. And
Yes.
I think you already talked about this a little bit. We were talking about like the finger in the butt, and but what cultural and social taboos create negative views of sexual health, particularly men's sexual health?
I think that men in general are afraid to have a rectal exam. And so that's why they're afraid to come to a urologist to be even evaluated. They may be worried that they may like it because the nerves that go to the penis actually go along the prostate. So when you stimulate the prostate, you're actually stimulating the tip of the penis. And the nerves that coalesce and extend to the tip can be stimulating for some.
Mm.
So maybe there's a fear of liking that and they're afraid to know that, or they're just not even sure of what that entails. And so Now that there's not a rectal exam all the time, I think that men should be less fearful to see the urologist, and to be able to check disease processes that are a huge difference if checked early, right? So the rectal, though, is a stimulating way. That's why some gay men enjoy rectal and some women enjoy anal intercourse,
Mhm.
because the nerves go along the pathway that is stimulatory.
Mhm. But they don't usually enjoy it when they're at the doctor's,
No,
because the doctor's job is not to get you turned on and aroused.
exactly.
And I also just want to add too that just because you have something in your butt doesn't make you gay.
No,
So,
no, exactly. It
and
does
people still
not, for
think that.
sure.
Yeah. Yeah.
It's for sure not. Yes.
Mhm.
But some people see things on porn, and unfortunately, conditioning men to novelty rather than intimacy is kind of where I wanted to go with this book, to let men know that, intimacy is huge. The more intimate you are and the more love you're giving, sometimes you get ED because you think that the person you meet should have this different, what they see on porn, this different activity. And then when they meet someone, then they're disappointed because that's not what they saw on porn. And it's at our fingertips now on our phones. Guys are intimidated from what they see, and then they are creating a stigma. That's a societal taboo that we have created, but they need to learn that that's not always what's present in a relationship.
100%.
So as a female urologist specifically, I
Yes,
think this is interesting because, right, you don't have assuming the same parts as a lot of these folks, right, that you're examining. And I'm
correct.
wondering if you have anything that stands out in your world, in your field, that you maybe never expected to learn about men's sexual pleasure. If you could share with our listeners, because I'm intrigued, and you've been doing this a long time. So if you're like,
Yes.
whoa, I never knew that, or whoa, I never expected that. Yeah,
It's
if you have it,
interesting.
tell all.
I,
This is the
I
tell
used
all
to
part.
think that men would be afraid to tell women. Actually, men are sometimes afraid to tell another man because they may not want to feel intimidated or, have any weakness. And so I think that sometimes my business partners didn't get as much information as I would get from men about their sexual health because they may feel insecure about that, right? But a lot of times they'll confide, but sometimes they're afraid unless you ask. So most of the guys that I would see, either they're being seen for urinary symptoms or their prostates enlarged, I often would ask them, what about your sexual health? Because many times they're afraid to talk about it. Because a lot of men will present with fatigue, they'll present with low sexual drive, but they will present with that, but they won't talk about having sleepless nights or being angry or overworking. And these sometimes are signs of either depression or low testosterone. And they actually have a hormone deficiency that can be improved if we check them. But if we don't check them and we don't know they have symptoms, you never know to fix that. So being open with patients and learning, having them learn about the disease process is important. However, you asked about the nerves and the sexual component. Just like our clitoris, the penis has analogous nerves, and the nerves that run along the anterior surface of the penis, or the nerves that run, they coalesce around below the head, what's called the frenulum. And that's actually the most sensitive part on a male. And many men, when I tell them that, when I excise that during a circumcision, they may decrease their sensitivity. They're like, what? That's the most sensitive part? I didn't know, they may not have known that. So educating people about the parts of the body that are more sensitive for men and sometimes for us is why I wanted to explain the anatomy and the physiology in this sense.
Mhm. Yeah, I think the same with what you're saying earlier about sometimes you men might open up more to you than to other men. I think the same applies with with therapy as well. Like your therapist, a lot of men that I've talked to feel safer working with a woman than a man because their brain isn't going into this like judgment competition thing.
Right.
And I'm not saying all men do that. So it's really just like it's by preference, right? I've always been
Yes.
interested in like male gynecologists, right? Because
Yeah.
I've had male gynecologists. First of all, I'm like, how
Yes.
did you get into this field? I don't know if I've asked enough of them because they all have different stories. And and I personally feel pretty neutral, whether it's a woman or a man, but I prefer working with
Me
women
too.
because I have the same bits as them and they
Yes.
understand it. And my bits are quite complicated, I feel like. So, but there's something about women professionals in the medical and therapy world. It can be a little more like gender neutral or something
Yes.
versus men, and like not hating on men. It's just kind of the design. So that
Yes.
makes perfect sense to me. Okay, let's talk a little bit more about the pleasure pieces here too, though. So, how does your book and also more importantly your work in urology help men have better pleasure?
So one of the things is I found interesting is that men don't even know enough about their bodies, much less women don't know enough about men's bodies. So I try to educate or actually share these anatomy and physiology in these chapters to guide people to what is more stimulating, what is secreted when we're excited, what hormones are secreted, what nerves are stimulated, and what parts of the penis or what parts of the perineum, the taint between the scrotum and the
Mm-hmm.
anus. Just it's a taint, just
Mm-hmm.
like how they'll say for women,
Or
taint.
gooch, we say gooch. Yeah, yeah. Yeah.
Or the area right behind the pubis, the penis extends much further than what extends from the body. And sometimes that area is also very stimulatory. And so educating people about the anatomy, but also the physiology involved in sexual function, I thought was very important for both men and women because some people actually really don't know.
A lot of people really don't know, like
Yes.
like a lot of people, or if
Yeah.
you or they know little bits and pieces here, but a
Right.
lot of people, well, I'm bringing this to pussy owners. A lot of pussy owners have never even looked at their pussy in a mirror, right there.
Or they don't
It's
know
True.
their clitoris. There's only a little bit of your
Yes.
yeah,
clitoris is external and the
yeah,
rest is
Yeah.
internal. Right. It's
yeah.
very similar.
Check out your genitals, whether internal or external. Like get to
Yeah.
know them for all
Yes.
kinds of purposes, not just health too.
And for
And make,
self-esteem, right? You have to have
yeah.
body positivity. If you know what feels good, or you may be able, of course, not during the act, but you may be able to share that with your partner. And I really talked about, the five senses: taste, touch, smell. All of these things are important in grooming or what may be a turn on to somebody. One person may like soft touch, and their partner's been doing hard touch all along, so it doesn't get they don't feel excited. Or the opposite. Somebody maybe just firm touch and they really like soft. And so learning about these parts of your body and what's stimulating to you is very important to share, not necessarily during the act because then that may spoil the mood, but maybe even before and or taste or smell or touch. All of those senses are very important. And what your partner loves, whether they appreciate gifts and you keep giving them, words of affirmation, they may not want that,
Mm-hmm.
or music, if somebody's turned on by a particular song, if you playing that or if you like candles, those are the things that can create a mood that should be even discussed because communication is key.
Mm-hmm.
Yeah. You might want to be choked out. You don't know. You just
Yeah,
need to
yeah.
ask. You got to
Go
figure it
go
out.
learn
Yeah.
about it before you do it, though.
Yeah.
Yeah,
Right.
That's true.
yeah.
So, which is a good time to ask you about if there's additional, because I like those tips, but if you have additional tips that people should know, especially speaking to men's sexual pleasure and
Yes.
health, but are there any secrets that you can share that people should know about men's sexual pleasure and their health? I think they tie together.
Yes. So, just for instance, the anatomy of the penis, the head, distal, if someone's been circumcised, between the area of the head and their circumcision scar, that's called the mucosa. And that's the more sensitive part of a man. And even just with licking or touching or, taste, suppose you've been taught by society that this is an ugly thing and you don't like it. How do you enjoy that part of a person if this is not good to you? Maybe you like ice cream and then you think of it as ice cream. Or if
Mm.
you like wine and you like to dip your partner's penis in wine and then lick
Mm.
it off, maybe that will enhance your pleasure because that part of the penis is the most sensitive part, and then the head. Similarly, in the clitoris for us, when the hood is pulled back, that part's really sensitive, similar to the male anatomy. They're very analogous. And then what's pleasure for you may be not pleasure for the next person. So somebody may like downward motion of hand, and somebody may want upward. And so you want to see the reaction on your partner's face when what they're enjoying to let you know what is pleasurable for you and them. But a lot of people think this is a negative vibe to do this. And so to change that philosophy, somebody has to want to, right?
Mm.
And you can't force somebody to do anything, and it should never be, because then it will never be enjoyable. So I try to change the word instead of job, blow job,
Mhm.
as just over bliss, just oral bliss. Sorry,
Mm. Oral
just
bliss, is that what you said?
oral bliss. Yes,
Oral
instead
bliss.
of
I like that.
oral
I
bliss.
know.
You
I've
like
been trying
that?
to find a good one for that. Where like, because it's the job part really gets to people.
Yes,
They're like, and I don't think people necessarily psychoanalyze it that way, but we want to make it so it's not a job. Like, yes, there's sometimes
yes,
sex can be like maintenance for the relationship, but it needs to be
yes,
consensual and still like something you're choosing. So the job is like, I already have a job. I don't want sex to be a
yes.
job too. Yeah, I like that.
Right, right.
Yeah,
Just
yeah.
oral bliss. That's my favorite one, at least.
Yeah. Yeah, I like that. And we actually talked about this on our blowjob episode because we Googled like where did blowjob come from? And it's the term actually is more related to the act of blowing your load and paying a sex worker for the job. And then the term just got kind of stuck. So another thing I would add to that, flavored lubes. Flavored lubes
Yes.
are great. There's a brand that we love called Xens that makes some really good warming flavored lubes. We also love the brand Wicked. I love their salted caramel. If y'all
Mm.
haven't tried them, you can get them at purepleasureshop.com. Use coupon code Shameless Sex to get 15% off. I'm really picky because there's a lot of nasty flavored lubes out there that taste like cough medicine. These are not that. And then all of a sudden, the dick is a lollipops.
Right, right.
Yeah.
And actually, just how it was revered back in Rome and then in Pompeii, the structures, but then also in Greece, they wore togas, right? And they're the ones who started with having it being a job. Actually, some guys at that time, it wasn't like men being gay. If
Mhm.
they owed somebody money and they would open their toga and they were paying for their work,
So that
that
wasn't
was a
like a
job
gay. It
then.
wasn't. It wasn't
It wasn't
considered gay
gay.
though. Yeah.
No, it
Yeah.
wasn't
Uh huh.
considered gay. It was
Yeah.
actually, paid for
Oh,
performance.
so the.
But
Oh
Hmm.
yeah, it makes sense.
yeah,
Yeah.
but then
Yeah.
after that, then there was the Kama Sutra that talks a lot about the body and positions, and so each this has never been a negative thing in other societies. We've created a lot of that negativity too.
Mm-hmm.
So
It's
changing that mindset is the key.
Aren't we the ones that also became all big? Sorry, got all excited about big dicks, and that it used to be more about big balls. Isn't that a thing? Didn't that I forgot who told? Didn't someone tell us that on a show, April? That like back in Roman days, it wasn't all about the big dick; it was about the big balls. But now we're all about dick and not about the balls. Did you hear anything about that ever?
No,
No.
but I'm going to
Okay.
look that up
Yeah,
because
look it up. Yeah, yeah.
I will. So big someone asked me about size and does size matter actually, and it doesn't usually to most women. Guys want to show off, if they have a bigger penis, because now we have fallofill where we can inject the penis just like how women inject the lips to make them fuller. We have fallofill where we inject the penis with hyaluronic acid to help it look fuller in the flaccid position even. And then there's PRP, which is what I do, where we draw blood, we take the serum off, and we inject it in the penis for erectile dysfunction. It improves blood flow, and it can actually really help with fullness of the penis for enlargement.
Mhm.
So size isn't that much important. Most women like the intimacy.
Mhm.
Size is really more of, I would say, a guy's thing
Mhm.
than just a woman. Now, that may be different, maybe because, as you get excited, the vagina dilates and lengthens. And that I describe in chapter 5. There's a whole chapter on women so that we learn about the anatomy of the woman and why, yes, a bigger penis may feel better because then it fills as you dilate. But it depends on the intimacy too.
And it depends on the size of the woman because all pussies are
Yes.
different
Mhm.
lengths and
Yes.
girths too, right? So it's not like
Correct.
all pussies want a big dick, or it's like there's plenty of big dicks that won't fit in a lot of pussies,
That's
right?
right.
So yeah, and if we get into the anal world, that big dick could be a problem. So,
Yes.
so it's
Correct.
not. And I do have friends though. I have a couple friends that are size queens, right? One recently actually was like, "Oh my god, I went on a date. It's my perfect penis," and she says her penis, and I laugh because I'm like, "You had sex with a penis," but um
That's
but
funny.
but that's just that person, right? That's not not everyone. I don't
Yes.
actually know. I did have a couple. I've had like one or two friends that were obsessed with big balls. They actually were turned on by that. His balls were so big. But again,
Okay.
those are those people.
Those are those people. But big balls could be hydrocele. So in men, they can develop fluid around the testicle. It's called a hydrocele. And we
Mm.
actually surgically excise that. And when we do that, it's actually a sac that's developed around the testicle and fluid forms in there. Kind of like if you hit your hand and you get a big, swelling, the body reacts by creating that fluid there. We actually excise that while they're asleep, of course, and evert it so it doesn't reaccumulate. If you just drain it, it comes right back. So hydroceles are actually pretty common either due to trauma or infections, and we surgically repair those. So they're not always just cute.
Yeah.
Or if they're heavy, you don't want them hanging in the toilet either when they're using the
Yeah.
bathroom.
Could be
So
uncomfortable. Is there
yeah.
other than it being heavy, is there a health problem to that hydrocele
Sometimes it
thing?
will stretch. Like one time when I went to Haiti to do mission work, and one guy's scrotum was down to his knee, which was
Oh
impressive. He
gosh.
had
Yeah.
3 liters of fluid in there.
Oh
And
God.
so I had to do a scrotectomy, which means basically you tuck the scrotum to make it smaller and excise a segment. But the health problem was he really had a heavy load to carry around, right? And
Mhm.
it's uncomfortable due to size, but then guys worry what they may look like in their pants if it's that
Mhm.
big.
Mhm.
That's absurd. But most times they'll come for size, but when it stretches the skin, and that's what hurts because the
Yeah.
nerves are stretched, and then the nerves are uncomfortable when they're stretched.
Yeah. I don't know. I don't have balls, but for some reason my non-balls are hurting when you say that. I'll just say it's like my partner has really big balls. And it
Yeah.
wears out like he'll go through pants like not but like it will start to like what you can tell like his balls like rubbing on the pants a lot.
Oh,
Like you have another hole in your crotch from your big balls. But they're not painful. They're not. I don't
They're
think
not
it's what
painful. Okay, good. It's no
hydrocele.
hydrocele. Yeah.
Hydrocele. Is that something and
Yes.
that develops with age? It's not like you're born with it.
No, usually it develops with age, but you have to make sure it's not a hernia involved. We check to make sure there's no hernias. So if it's something that's concerning or too big or you could put a light up to it in the dark, and if it illuminates around the testicle and you see
Oh.
testicle and then fluid, it needs to be drained. But usually we don't drain it unless it's painful or discomfort or size is
Yeah.
too large. But seeing a urologist in that case, that's one way to get a male to the urologist to
Yeah,
be
there you
evaluated
go.
for their
Yeah.
PSA and to check for prostate cancer. Because many times guys have a lot of underreported symptoms because they're afraid to be seen, you know.
Hmm. Go see your doctors and your urologist. Don't wait and don't mess around. Like the story April was telling about her
Yes.
stepdad, right? It's
no, no,
not
my
worth it.
father-in-law.
Father-in-law, sorry.
Father-in-law, yeah.
Sorry.
And then
Oops.
that's the thing. I do free consults at Quantum Health and Wellness Center, even about prostate health, just so people are educated about it. Because that's the key. I think it's education people are lacking, and then the fear coming in as a result. So just learning about it is half the battle, I think.
Hmm. Yeah. And then you already kind of commented on this a little bit, but well, I guess you're saying more that you talk about female anatomy and female pleasure there. But so let's just say, what about partners that are the admirers of penises? That I'm in a relationship with someone that has a penis, or I love having sex with penises and cocks. What do you have any tips for them on how they can both support and explore their partner's shame-free penis-centric pleasure?
Yes. So, in regards to shame, you have to work from within. I talk about intimacy as into me, I see.
Mhm.
And that means you have to work on
That's from the Love
yourself.
Guru. You know the
You
Love
like
Love
Guru.
that?
this. Yeah.
Yes.
Yeah,
Love.
Yeah.
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 You have
Mike
to work
Myers.
from
Yeah.
within.
Yes, it's
And I
true.
think that's so important. And we always put something on someone else. It really is our job to fix our own physiology and then be able to share it with someone. So if someone has fear, they may need to read my book so they can learn about it,
Read the book. Yeah.
how to get ahead, and actually just learning about what may be pleasurable to you. Most people don't realize that giving is better than receiving, that you can get actually stimulated by enjoying the act of fellatio more than the receiver, because
Mm.
it may be the pleasure that you're giving someone else and their happiness, and you're enlightened by that. And that's the part that I wanted people to learn about: the compassion, the care, but then also the physical being. Self-esteem, number one, body positivity. And say you're overweight and you don't like how you are. And overweight's fine once you're happy with yourself. but being healthy. If you're overweight, maybe a sign that you're not so healthy, you know? And so your sexual dysfunction may need to be fixing your physiology, which means diet, exercise, reducing stress, which sexual pleasure reduces stress, and then sleep.
Mm-hmm.
We're not sleeping enough. That really affects our day to day living. And then, yes, the biohacks of the supplements, you know, your NAD plus, which is helping cellular degeneration or helping to reduce health dysfunction or improving DNA repair. Everybody talks about it as a longevity thing, but it may be important to prevent cancers, right? To
Mm-hmm.
convert homocysteine to glutathione by methylation. And those are things that I try to explain in my consult or in the book as well, so that people can learn a little bit about why do I take a supplement? Why do I take magnesium? For
Mm-hmm.
sleep, it may not just be for relaxing your bladder. It's
Mm.
also to help with
I
mental
didn't know it relaxes your
clarity.
bladder. Magnesium
Yes.
relaxes your, is it all the magnesiums? Because there's glycinate, citrate.
Magnesium glycinate
Yeah.
specific. So
Okay.
citrate is more for
Oh.
bowels. Yeah.
But so relaxes your
But
bladder. This is for
mhm.
people who have like tight pelvic floor, or like how does
Yes,
that
it
help that?
really helps with pelvic floor dysfunction.
Oh,
It also helps in people who have trouble sleeping because it relaxes all muscle, and even the muscles, like blood vessels, are lined with muscles and affects blood flow. And it affects the bladder because the bladder is a smooth muscle. Just like your
oh,
vein in your arm, you know how you can't tell it to dilate or contract, it's based on volume, but you
mm,
can tell your arm to move because that's skeletal muscle. And
uh,
then your vein is a smooth muscle. And so magnesium helps smooth muscles relax a lot.
oh,
Mm,
fascinating.
I
Hmm.
love that.
I love that I'm taking magnesium every night. Good job, Amy.
Yes.
Way to go. Calming. So I guess this is probably a little sneak peek about some of the things that you can learn from the book. But are there anything else?
Yes.
Can you tell us a little bit more about your book? You went into brief details about certain chapters, but number one, are there any important takeaways you can expect? And also, how can people, number two, how can people buy it, find it?
And do you
Yes.
have an
So
audiobook too?
Oh yeah.
not yet. I need to get
Mhm.
an audiobook set up, but I do have ebook and it's on Amazon, Barnes and Nobles, and it's How to Get Ahead or How to Get Ahead book. It's also on Instagram, Facebook, you know, or under my name,
And
Suelyn
it's a
Hall.
dash
There,
head, everyone, by the
A
way.
dash
Like, and she
head.
did that intentionally.
Yes, yes.
Yeah.
Pun intended, yes.
Yes, yes.
But the neurochemical in our brain, I think that learning about how the brain works with the body, that's an important component, and about how sex is important to reduce our stress and to improve our mental, physical health, how hormones like testosterone is important in women as well as men. Most people think of it as just sexual. It's important for bone health, helps reduce osteoporosis to osteopenia. It helps for mental clarity. Most of the men that I treat with testosterone, they say, oh, I can teach more classes or I can read more books.
Mm.
I'm like, hey, I thought it was for ED.
Mhm.
They actually notice the mental component and then their performance. You know, they're able to work harder or be stronger or, you know, improve muscle strength for us as women as well. As we age, that declines. And so that's one of the things I wanted to express in the book. I also go into trauma. And when somebody goes through trauma, how to get beyond trauma to be able to love again. That's very important.
That's really important.
Mm-hmm.
Yeah. Mhm.
Especially if you've been affected by a authority figure as a
Mhm.
child, right?
Mhm.
There are a lot of people that have been abused mentally, physically, and it really affects their long term health, right?
Mhm.
Sometimes you see somebody who's obese, you don't know that maybe they went through something to get to that point where they were eating to get rid of that mental component, but they could shift that to learning about themselves and be able to break free from the trauma.
Mhm.
And I think that's a very important. It's chapter 6 in my book about trauma, and then How to Love Again is in chapter 7 to physical, emotional well-being and mental well-being.
Wow, your book is has just I mean I have it's on I know the copy's on the way to us and so I have yet to read it
Yes,
but it says sounds like it has so much information in it beyond I mean I love that you're also the way you're talking about understanding anatomy as an important part of understanding pleasure whereas like you know we teach pleasure all the time but I personally I'll speak for myself I don't know everything about anatomy I'm not an MD like you so I think that's brilliant and you're bringing in the more like the psychological health benefits there too and trauma work
yes.
that's amazing. And so, okay, so that's your book. We know how to buy your book. Can you, before we wrap this up, can you tell us and our listeners a little more about your offerings, the other work that you do, how people can find you, work with you, all the fun things?
Yes. And so at Quantum Health and Wellness Center, which is quantumhealthmhk.com, which is the website, or on Instagram and Facebook, I offer information about hormonal balance because people don't realize that, yes, as we're living longer, we need to have a balanced hormone. And as we age, for us women, we go through menopause, but men go through andropause. And so learning about that is an important part as well. And then I talk about reducing cortisol. The way I like to describe everybody's body is a car. Thyroid's the engine. And some people don't need the whole new engine. They may just need an oil change, meaning that they need the components to make the thyroid function better, such as zinc, selenium, iron, and iodine. Mm-hmm. They make your thyroid work better because some people that have cold extremities or fatigue may actually have a thyroid problem. Mm. Cortisol is the other component, which is the gas in the tank. And cortisol is due to stress. And we have all kinds of stresses, whether it's we don't like our hair or our makeup, or, if you eat a blueberry that has pesticides on it, that's a stress, right? So mm-hmm. It's a lot of cortisol issues. And then tires are the estrogen and testosterone and progesterone. And those can sometimes, but if you just fix tires and you have no engine and you're out of gas, the car's not going anywhere. Mm-hmm. That makes sense. That's why all three are important. And I kind of explained that at Quantum Health and Wellness Center. And as I said, I do free consults. And then I also try to manage patients holistically. So I send people to a psychologist if they need body. So rehab, massage, float therapy. I used to have a float tank actually where people can actually de-stress and reduce their cortisol as well as detox. And then checking hormone levels. And then I always recommend exercise. So I used to have a personal trainer that can help you to do things safely so you don't get injured. And then also in regards to massage, float therapy and everything, sexual pleasure, very important. Yes. And in my end of my book, I actually have 50 ways to blow your lover. So you
all right. Well, not if you weren't sold before.
Now you're gonna how to get ahead, everyone. Yeah. How to get ahead.
Just 50 ways to blow
there
your
it
lover.
Is.
I didn't even know it was 50
Dr. Suelyn.
That's a lot of ways.
Not 50 ways to leave your lover like Paul Simon.
No, exactly.
That's amazing. Go check out How to Get Ahead, everybody. Thank you, Dr. Suelyn Hall. This was really amazing to talk to you and to learn more about all of your work and what you're doing. For everyone out there, go buy a copy. Authors can only feel your love by buying their book. Mm-hmm. So go get it. It's on Amazon, Barnes and Noble, and definitely check out more of Suelyn's work, quantumhealthmhk.com. That's really easy to remember. You can also find the link in the show notes. We'd love to see you again, Dr. Suelyn. Thank you so much. To all of our listeners, thank you for being part of our shameless sex revolution. We love you. We really can find how much you love us by giving us 5 stars on your favorite listening app. That helps more people find their urologist and their ability to have more shameless sex, also more sexual health, is by education and by having this free resource. And this is free because of your rating us and helping more people find us. So that's your job for today. Okay. Then after that, you can do blow jobs, but JOB,
oral bliss,
the oral bliss. Yes. So go ahead and do that, everybody. And we'll see you next Tuesday for another episode of Shameless Sex. All right. Ciao for now.
Thanks for having me.
Yes. Oh, yeah. Oh, you don't leave yet, though. You can just press, you can just stop the recording. Yes. Yeah. Yeah. Yes, because we'll say a proper goodbye to you after. Yes. Yeah, we confuse people.
I'm starting to sweat though.
I know we have the little heater on in here. Got warm. It's actually